Welcome to Chapter 15. I'm at CI Institute, or EMETS. Chapter 15, Spine for the Basic Machine Operator. All right, let's get started on spine, Chapter 15. All right, so our objectives is to name the regions that make up the spine and identify each on an anatomic diagram on a radiograph, also on a radiograph. Identify the diagram of the parts of a typical vertebrae and identify significant positioning landmarks for the spine by palpation. Also, correct body part and positioning for most of our routine projections of the spine and how to correctly evaluate radiographs of the spine for positioning accuracy. We also need to be able to describe and recognize abnormalities on the radiographs for pathological conditions common to the spine. All right, so spinal regions and curvatures. You have your cervical spine, your thoracic spine. Here's your cervical here, and your thoracic spine, your lumbar spine, your sacrum, and your coccyx. And looking at the curvature, you have your lordotic curve, which is this guy right here. You have your kyphotic curve. You also have a lordotic curve here, which is the lower lordotic, and then the final kyphotic curve. And again, they're specifically on the base of the curvature. One is in, as you can see, kyphotic, okay, and it bulges outward basically. You see a lot of people with kyphosis, elderly people. And then you have the lordotic curve of the spinal, where it's this direction, lordotic curve this direction, and then finally the kyphotic here in the sacrum. All right, body parts are parts of the typical vertebrae. You have the body, the pedicle, the transfer process, the lamina, vertebral arch, the spinous processes, the facet, superior and inferior articular processes, and the vertebral notch and vertebral foramen. Let's get rid of me. All right, so here, this is a cutout of what you can see here. The spinous process, this is the, if you're looking at it, it's the posterior portion of the spine. We have the lamina, the transverse process, the body, the vertebral foramen, which is the center mass in which the spinal column runs through, the pedicle, which is the small process that is the supporting body for both sides. This is attached to the body. Your disc is what lays in this area here. And then the facets, which spin off of the pedicles themselves. And you see here, this is a lateral view. This is definitely a test question, folks, so make sure you remember that. The body is the anterior portion of the vertebral process, and the spinal process or spinous process is a posterior. Okay, all right, so cervical spine, C1 or axis, and then C2 or atlas. So let's talk about these two guys. C1 is your axis. It is the very first vertebrae. You have the posterior arch that's included on that. You do have transverse processes on both sides. You have what's known as the lateral mass, this area here, lateral mass here, and then the superior articular processes, which is this guy right here, and then your transverse atlantal ligament, this guy right here. This is what holds these two together. And then the transverse foramen, which is here in this area on both sides. Okay. And then over here, if you look at the atlas, this is cervical vertebrae 2. This is cervical vertebrae 1. It's very, very small. C1 is very small. All right, so if we're looking at the cervical 2 or the atlas, you can see the facets on both sides here and here. This is the dens. This is one of those, this is the odontoid process. That is one of those photos that we are radiographs that we try to get, and it's very difficult to get, but if you work at it very diligently, this is one at a 45-degree angle through the mouth to be able to get the dens to see if there's a fracture there, fracture in C1 or C2 at the dens. It's a very difficult shot. It's one of those ones that definitely challenge you. So this is a superior, aspect, view, and this is your inferior view. All right, typical vertebrae, C3 through C7. Okay, these are the normal construction of vertebrae. They're much smaller when you start looking at it from the standpoint of, say, your lumbar spine. But let's take another picture here. As you can see here, this is the dens. Okay, it's the very top, which is the atlas, and then the axis. Okay, you have C3, 4, 5, 6, and 7. Okay, the zygophyseal joints are the joints that are in between up high in the neck, and then these are your spinal processes, and then the vertebra prominens, where this is the very base of C7. This is that big bony protrusion that you feel all the way down your spine to where it reaches C7. All right, typical vertebrae, T1 through T12. These are your common vertebrae. These are your thoracic spine vertebrae. They do have zygophyseal joints. You also have a much larger vertebral foramen, where now the spinal cord just continues to travel on down. It still has the body, as you can see here, and these are the different aspects on both the superior side and the inferior processes. Okay, and we go to the lumbar spine. Okay, L1 through L5. These are much lower in the back. Looks very much so the same as any other vertebrae. Notice that the vertebral foramen starts to narrow out. It gets a little bit smaller because the actual vertebrae itself does get smaller. Right, so zygophyseal joints, they're on both sides, as you can see here. You have, from the superior access, from the superior articular process to the floor of the intervertebral foramen, gives you an idea of the distances and the angles of their shapes of those joints. These are very, very important joints because of the fact that this is where all your nerves and blood vessels run. All right, so then you have the sacrum and coccyx, which is all fixed vertebrae. You have sacrum 1, 2, 3, 4, and 5, and then you have your coccyx, which only is considered as one vertebrae with a apex on both ends and then a base. So those are your coccyx there. This is integrated into the pelvis. All right, so palpable landmarks for cervical spine positioning. You have your EAM, your mastoid tip, your gonine, your thyroid cartilage, and then the top of the shoulders and vertebral prominence is where we begin with C7. So these are your different positioning for your cervical spine. Cervical spine. All right, so palpable landmarks for thoracic and lumbar. T1 is right there, approximately 1.5 inches above the jugular notch. Then you can count from there: 1, 2, 3, 4, 5, 6, 7. Mid-thoracic, 8, 9, 10, 11, and 12. All right, you can see the xiphoid tip is here. This is at thoracic 10. Okay, mid-thoracic is around the third rib, or about the fourth rib, somewhere between the third and fourth rib. And it's right at the sternal angle. Then we go to the lumbar, L1, okay, through L5. Lower costal margin, or the 10th rib, is where L3 is. The iliac crest is where L4 is. And then the ACES is where S1 and S2 are for your sacrum. And the pubic symphysis is basically right in line with the apex of the coccyx. All right, so examination. Place the IR bucky in the tray. There's your bucky tray right here. This is an upright. Place the patient erect in front of an upright cassette holder or recumbent on the table. Make sure you get all that jewelry off. Your practitioner is going to be very upset if you leave a chain around the neck, because you can most definitely see it. So be sure always remove jewelry. Nipple rings, all that stuff has got to come off. Clothing and other items that may be within the radiation field must be removed. Place appropriate markers and then shield the gonads and take your image. All right, so AP axial and open mouth projections of the cervical spine, as you can see here. This is an AP axial, anterior posterior axial, and also a open mouth. There's your open mouth and an AP axial, okay, of the cervical spine. Those are the corresponding pictures you're going to get. There's your AP axle, and then here is your open mouth projection of the spine. Here's that beautiful, wonderful little dens view that we want to look at. We want to be able to see. All right, so lateral projection of the cervical spine in the neutral position. Okay, as you can see, here's your Bucky system that you have your IR in. This is nice and centered, as you can see here at around C4 to C5 is where your focal point is. It's your focal spot. And then here in this particular radiograph, it's a very good representation of seeing the anterior arch of the atlas of C1 right there. Good stuff. And then C3 here. Okay, and then there's C4 right here. Good stuff. And there's your trachea. That's where your trachea begins. All right, so lateral cervical spine projections in flexed and extended positions. You have very, very specific that we want to be able to see. Extension, obviously, is when we're going to extend, okay? And then flex is flexion, so that we want to get a good representation of a flexion. And both of these are done from a lateral standpoint. You can see the fact that your good focal points is right there, that C4, C4, C5 area. All right, so AP axial oblique projection of the cervical spine. Notice that the patient has a slight tilt between 15 and 20 degrees. That's what makes it oblique, and it's AP because it's anterior to posterior. They're really looking at the intervertebral foramens to see if there's any damage there. All right, lateral projection or the cervical thoracic region, otherwise the swimmers. Notice that the patient's on its side. You can see the clavicle being represented, here, and then a good representation of the thoracic region, cervical thoracic region, where they join together here, and to be able to see them because there's C7 right there. Okay. AP projection of the spine, of the thoracic spine. As you can see, here's a good photograph on it. You're going to begin right up in here, okay, and then work your way down. This is all the way down to the 12th. Notice the focal point is right in the center of the sternum. AP, anterior to posterior. Also make sure to take note is that we want to be able to position the patient's head so it's comfortable, keeps their airway open so they're not struggling to move around and those kind of things. IR is underneath in the Bucky system, and then notice that your collimator, again, mid-sternum, perpendicular to the IR. All right, so lateral projection of the spine, as you can see here, here's thoracic 3, T3, and down here's lumbar 1. All right, got a nice representation here about mid-spine, just below the scapula. Here's your scapula right here. So you'd want to use that as your focal point to get a good projection of the thoracic spine. All right, AP projection of the lumbar spine. Umbilicus is primarily your landmark here. Make sure that we're protecting the gonads. I don't see any protection there. Not a good representation on this film, but looking here, L1, and then down to the sacrum. And there's your gonad shield that's right here. Obviously, it's not this dude, but there it is on the X-ray. Right, so AP oblique, notice he's got some about 45-degree angle away from the table, but still we're looking for the umbilicus being our center focal point. All right, lateral projection of the C-spine, of the lumbar spine. We're now using a wedge here, and we're focusing straight down into the lumbar area. Again, here if you look, this is T12. This is the end of the thoracic spine. It's where the lumbar begins. Okay, this is L4. Very good. And nice, good projection here. You can see all the different spaces very well. You can see the intervertebral foramen, the disc space. It all is a very good dense mixture of density and contrast. Lateral projection of the lumbosacral area. A lot of people get a lot of back pain in this area, so they want to take a really good look at the lumbar sacral area down at the bottom of the lumbar spine where it comes into the sacrum. All right, so apiaxial and lateral projections of the sacrum here. You can see these guys again, 15 degree, on your projector at this point in time on the beam. This is a left projection, pelvis. You can see the pelvis here and also the spine. This is, apiaxial, and then of course you have your, apilateral, and then you have your axial representation as well. All right, so apiaxial and lateral projections of the coccyx, that's kind of a hard one to get because there's a lot of tissue that's involved. But notice that we're all the way down to the base of the sacrum, of the sacrum spine, S-spine, in order to get the coccyx view. And there's your coccyx view right there. And there's the distance of it. That was the tip. Right, so pathology, transitional vertebrae, are they abducted, subducted? Are they anomalous to the ribs? Do they have sacralization of L5? Is there an extra vertebrae? Is there signs of spinal bifida? As you can see here, this is a very telltale sign that the patient has had spinal bifida because it's so wide and so open. This person was probably born with their spinal column outside their lumbar spine area. Right, some fractures, compressions, as far as the pathology is concerned. As you can see here, we've got some anomalies here, anomaly there. They're going to be taking a very close look and see exactly what we have, but there's definitely some differentiation in the bodies of those two vertebrae. There's your L3, so this is L2 and L1. In summary, we talked about cervical and lumbar regions have lordotic curve. The thoracic and sacral and coccygeal regions have a kyphotic curve. So you need to remember that, innie versus outie. Bony landmarks such as the mastoid tip, jugular notch, and iliac crest are used to position the spine. Also, we had some basic projections of the spine to include cervical spine, thoracic, lumbar, sacrum, and coccyx, all of the AP, obliques, and laterals. Anomalies of the spine include transitional vertebrae, anomalous ribs, sacralization and extra vertebrae, and also spinal bifida. And also, we may also see fractures of the spine to include compression and pathological fractures as well. Pathological conditions of the disc include degeneration and herniation. All right, folks, that is the last of this video. If you have any questions, be sure to send it to us, student@emets.net or student@emetsciinstitute.com, depending on which course you're taking. This is an oddball photo. Okay, there's a little girl standing next to the deer. Look how the deer is looking at her, going, "Whoa, I see you." Anyhow, thanks again, and we'll see you next time.